Yes. As you will see, we are going to be recorded for the day. So our hope is that we will be able to share this recording with everybody after the presentation's done. We will very likely put it up on our YouTube page, as well as find a home for it on our website at some point. So if you need to refer back to it or make sure you can kind of utilize it at any point in time, it'll be hopefully easy access for you. So do please make sure that you are muted if you're not talking. We would also appreciate during this training if we're able to save any questions until the end of the presentation. So feel free to throw some things in the chat. But overall, we're going to try to kind of stick to what we have so that way we have all of our information kind of all in one place, and then be able to take some questions at the end as well. So if you have not met myself before, my name is Claire Spada. I work for Problem Gambling Network of Ohio. I'm the Workforce Development Manager and just hit about a year in my role here. Prior to my role here, I did work for a community agency called Lake Geauga Recovery Centers, where I was a full-time problem gambling prevention specialist. And I am just a prevention person through and through. I also have my Ohio Certified Prevention Consultant certification as well. Scott, I'll let you introduce yourself.
Hi, good morning. Scott Anderson. I'm a problem gambling treatment coordinator with the Mental Health and Addictions. Been in the role since 2010, right before the casino legislation passed. Prior to that, I worked in the prison system as a drug and alcohol counselor, mental health counselor. That's my background. Worked in the community and then came up through the prison system before I was promoted up to the big central office downtown.
Awesome. Thanks, Scott. So we're going to kind of be co-presenting today and kind of taking turns. So if you do have any thoughts or questions, we'll probably be bouncing off of each other quite a bit. So thank you for coming. What we're going to be really talking about, I know it's only scheduled for a half hour, so we're going to try to get through everything pretty quickly and be able to hopefully allow for a little bit of Q&A at the end. And really what we're going to focus on is some of the new updates that are coming to the problem gambling treatment allocation report that all of you have been filling out. We're also going to be providing some information on spending guidelines for problem gambling funding. And what I'll say is that none of the guidelines have changed, but there may be some new people in the room. And so we want to kind of do a good refresher for people and remind you of different ways that you might be able to spend your treatment and prevention funding. And then we will be talking about a spending guide resource, as well as some ways to get some additional resources when it comes to talking about problem gambling funding and getting suggestions or ideas on how you might want to consider utilizing those in your community. So Scott, I'm going to let you take this slide.
Okay, thank you. Just as an overview for those of you that aren't aware of how this works, OhioMHAS gets 2% of the tax revenue from the casinos taxes after they pay out winnings and all their expenses and so forth. Casinos are taxed at 30%, and that gets divided down across law enforcement, education, the counties where the casinos are for infrastructure. 2% comes to us for treatment, prevention, education, and research of problem gambling, or to mitigate the harm of problem gambling. So initially, we've divided the state by all the ATOM boards and then went by population, and we send out quarterly allocations to every board in Ohio. What we ask is that at the end of 6 months or twice a year, we learn from you how many folks were screened, how many were identified, and how many were treated. And then in some cases, other things that you might do that are unique to you, or some ideas. For instance, Licata Way in Lorraine came up with an idea to put the little before you bet stickers on pizza boxes for March Madness, and they went around to different pizza places and they sent that all out. So we've shared that across the system with anybody else that's interested, because it's a great idea. We initially said to divide that money 60-40 between prevention and treatment, because we were going to try to get out ahead of some of the harm. That's not a stone cold rule. Some folks used all their money for treatment. Some people didn't have competent counselors in place, and they shifted the money to prevention. And at that time, we had the opiate thing start up, and a lot of this money, because it says problem gambling and other addiction fund, with a quick email to us could be used. But right now, sports betting, you can go on to the next slide there. Yeah, I should mention the report that we're going to go over with you guys is an email to me. The prevention dollars can be reported in the GFMS system. There isn't currently a place to put treatment numbers into the GFMS. So next, and the reason this is important right now, we have the sports betting came about in January. In Ohio, $1.1 billion was bet in the first month. Calls to our helpline tripled in that first month. And we here at the department are getting quite a bit of scrutiny on where does this money go? What do you need this money for? Because there's money allocated in the sports betting that's going to casino control, and casino control is going to say where it goes. So if we can't show, in a pretty meaningful way that people are being screened and people are being treated and people are being helped in some way with this money, we just won't get it. As simple as that. So what we're asking for is pretty simple information. We want to know which agencies in your board area are providing gambling treatment, gambling prevention services, and what they're doing. If you're doing anything with kids or in schools or any kind of outreach with that population, we'd like to know a little bit more about that. And then there's a place in there for an expenditure, what's the percentage of dollars that are being spent, so then that we can respond appropriately to you. So we would like to know who is treating gambling in the different areas of the state. And Claire and I have been working on this. Claire, I should say, I have about a 10% role in it, but Claire's been reaching out over the last year with the data from the different board areas. Some board areas have just not reported. Some have said they've screened, thousands of people and not found anybody, which is basically statistically impossible. And we have people treating gambling in the state that have no training, no competency, no endorsement, no anything. They're seeing people sort of outside their scope of practice. So we would like to obviously amend that and have some list of folks, because we have a resource guide for that helpline, and we had close to 1,500 calls in January to that helpline looking for treatment. It used to be there was 4 casino sites and 7 racetrack sites, and they were scattered around Ohio. Now we have this. Sports betting is in your pocket. There is a casino in every pocket of every community member in your town. So there is no longer a need to leave the house. This problem is right in your pocket. So we'd like to know the names of the people that are treating gambling in your community. And then we have the screening numbers, and that's how many folks were screened, how many were identified, because not everybody identified is going to be engaged in treatment right away, and how many folks actually received the treatment. The screening can take place at intake. That's not always the best way to find folks, because they have developed a therapeutic relationship with a clinician. They might have other consequences that they're trying to resolve, so they can get things done with children or employment or something like that. They may not be forthcoming. It's good to screen again later in the process, and we'd like to know what screening is being done. Suicidality is a huge issue with this population. We'd like to make sure that you're doing some sort of lethality assessment throughout the process of their treatment, and then what type of groups are going on. So we'd like to know the name of the clinician and what their endorsement. We worked pretty hard with the Chemical Dependency Professional Board on creating an Ohio-specific endorsement for gambling treatment. PGNO has been our training partner in that for several years. We're up to now 4 times a year that the full array of training is available. So you could get your GAM endorsement certainly within a year, but probably more specifically within 6 months if you did all the training. So that GAM endorsement is extremely accessible. It's user friendly, it's not expensive, and you can use the gambling dollars to pay for it. So it's free. So you can get in pretty quick on that. So we would like to know, what's going on in your community. We are very closely. We just finished our third prevalence survey. We finished data collection on December of this 22. We're going to have those numbers available. That we'll have board level information that we can share with you again, as we did in 2017. So we're going to be able to specifically say, men of this age, women of this age, this type of gambling, this income level, this education level. We're going to have a lot of good data for you very quickly as soon as we get that analyzed and out. So you can use these dollars because they're not federal money, they're local state money. So as many of you know, the rules are pretty broad on what you can spend this money on. Family counseling, individual counseling, group counseling, telehealth, printing materials. We're going to get to that in a minute, but we just like to know what's going on in your community. So this reporting form is available on our website now. This is who can treat gambling and what kind of credential they need. We'll have this available. It's on our website already for your to look at. We'll send it out to anyone that needs it as well if you need it. And simply we ask that that's back to us after the first 6 months and then after the annual, so that we know what's going on.
And if I could just make 2 quick comments on it as well, I think one thing to note is that this time around, we are asking specifically about adults versus minors, because I do know some board areas are looking at screening minors. So if you're keeping track of that, please share that with us, because I think that would be really helpful for us to know. And one additional thing that I will just share is that we really highly recommend, if you are not using a gambling specific screen in your community, you should be. Is I guess what I'll say. So if your screening tool is just your generic screening tool that your agency already has, it may not have great gambling screening questions in it that may be applicable or helpful in identifying. So we would really recommend checking out. I like the BBGS and the SOGS. The SOGS RA is specific to adolescents, and then there's also the NODS is another one that some community agencies use as well. But those would be some tips that I would say are probably important to think about when you're looking at how many people are we screening and what are we utilizing.
Thank you, Claire. And as I just mentioned, you can use these gambling dollars for obviously treatment and your prevention, but also that workforce development. These dollars can be used for those stages trainings, for webinars, for national conference that's coming up in Washington, D.C. in July. We have our conference here that PGNO coordinates with us. That was in February of this year. These dollars can be used for that. They can be used for outreach. We have folks that do movie pre-roll. We have a toolkit available on the Before You Bet, as well as the Change the Game. All of the assets are there for you to download the art if you want to print any of these assets. We can also personalize those assets free of charge. So the money is really out there to use and use, in lots and lots and lots of different ways. Obviously, you can't give somebody $100 to go to the casino for research, but short of that, you can use these dollars for just about anything that's related to gambling promotion, prevention, treatment, or the training of your staff.
Awesome.
And if you have a question about, if you're worried about one of those things, please give us a call. We'll be happy to help you guide that process. I'll turn this over to Claire. She's the prevention person, and she can guide you through some of these.
Thanks. So I know that the way that the funding is typically divided up is kind of like, here's your prevention dollars, here's your treatment dollars. So we really just wanted to give some ideas of ways that you might want to consider utilizing this within your board area. So when it comes to prevention funds, you can really use this to actually pay for staff time. You can use it to pay for any sort of materials, anything that you're going to be using that supports the 6 CSAP strategies that you're probably already supporting within your prevention communities. So you can purchase curricula or materials. You can purchase promotional items and swag. At my old agency, I mean, we had water bottles, we had stress balls, pens, all kinds of things that we were using our gambling funds for. You can also use it for any sort of marketing items, printing items, things like that. If you're doing events and there's a cost to it, you can use gambling funds to be able to pay the cost to be able to be a part of any events. You can utilize it for time or any additional materials to provide environmental scans in your area. There's actually a couple of communities that have recently or are in the process of completing some environmental scans of the sports betting type C kiosks in their communities. Or if there's any other tabling needs, you can spend the money on tablecloths or on, those gigantic promotional things that stand next to it with your name and information on it. So funding could be used for that. You can also use it for community planning or plan creation through the strategic prevention framework, through logic models. If you need to pay a consultant to help your agency with that, you can use gambling funds for that. You could also use it to pay for any sort of workforce development or training for prevention staff, and that includes everything. So if they are traveling down to the Ohio Gambling Conference, or if they're attending any sort of conference or training that requires registration costs or per diem meals and things like that, gambling funds can be used to pay for that. It can also be used to pay for membership. So if you would like to be a member of Problem Gambling Network of Ohio or the National Council, we actually do offer joint memberships. So you can have prevention staff, treatment staff, admin staff, whoever you want. You can use prevention funds to pay for those gambling specific memberships. And that's not the full list. I mean, these are just ideas. So when I say and more, I literally mean and anything else that you can really think of. So if you're trying to do a community needs assessment in your community and you need funds to be able to, utilize some sort of documentation or what apps or things like that, you can use it to pay for that. You can pay for coasters before you bet coasters to do a coaster campaign in your community with local bars and restaurants. You could even use it to partner with other agencies in your community for community events that you want to hold. So really the sky's the limit in how you'd like to spend your funds. And this is my standard go-to slide that I made just on how to basically utilize it and really what you can do to support prevention efforts in your community. So you can do it within all of the CSAP strategies. This is something that we definitely have a couple of trainings where we talk a lot more about in depth. But just to share, just a reminder that prevention's prevention. It doesn't matter what type of prevention that we're doing. When it comes to the treatment funds, again, we can use it for any kind of treatment that's going on within your community related to gambling. So screening, assessment, treatment. If you're doing MAT in your community related to gambling, you can include that, aftercare programs. You can and also should be offering treatment for loved ones as well. I know that I have definitely gotten phone calls from parents and spouses who have been concerned about their loved ones and who really just need support themselves. You can use gambling funds to be able to support them. If you're doing gambling specific peer recovery support, that would be amazing. I don't think anything like that exists, but it's something that you may want to consider in your community if you already have a great peer support system. It can also be used to pay for workforce development and training for clinical staff. And again, all the same rules apply: mileage, lodging, meals, and things like that. So if you have clinicians that need to get trained, you can absolutely use treatment funds to pay for that. You can also use it to pay for credentialing fees. So if you have clinicians that are looking to get their gambling endorsement or to get their international certification, you can use gambling funds to actually assist them in paying for in paying for the gambling endorsement fees. If somebody's a PGNO member, we will actually reimburse their gambling endorsement fees anyways. But if they're not, you can use it to supplement that. And again, you can use it to pay for gambling specific memberships. And again, and more. So, what more could it include? If you're using it, providing gambling through telehealth platforms to reach gambling clients in your board area, that would be fantastic. You can use it to pay for in-service trainings for your staff members if you think that that would be beneficial. You could also even potentially use it. This would be a little bit more involved, but if you wanted to provide micro grants to partner agencies, you have one agency that is the main agency, and you have partner agencies that aren't necessarily providing gambling treatment, you can give them some funds to be able to refer clients to that agency that is seeing gambling clients. So again, whatever you can dream of, you can spend it on, as long as it's related to gambling and falls underneath the treatment umbrella. And just as a side note, there must be funds available to pay for treatment if there is a community resident that presents with a problem gambling diagnosis. And while we work really closely with the problem gambling helpline at the state level, unfortunately, there are still many communities that don't have anybody local that is actually able to treat gambling. And we would really love to be able to get more people connected to somebody locally in their community that can support them in treatment. Just a couple of brief slides on competency, because if you don't have anybody competent in your community, here's what it would look like. So if somebody is licensed through the Chemical Dependency Board and they have their LCDC II or higher, they are eligible to apply for their gambling endorsement. There's a preliminary endorsement, and then that moves over to the renewable endorsement over within 2 years or less. Most people move over within a year or less if they're able to start working with some clients. If you have counselors that are licensed through the Counselor Social Work Marriage and Family Board, they are still subject to developing competency. They're not just automatically competent. And really what both of these require or would insinuate is that you have a clinician that has at least a minimum of 30 hours of education that's specific to gambling. And we'll talk here in a slide about what that could look like for some of your clinicians that might be interested in being competent. We do also have support from OhioMHAS. One of our staff members, Abdullah, is actually paid to be able to help guide people through the process. So if you have a clinician who's actually like, hey, I want to get my gambling endorsement, what do I need to do? I put Abdullah's information up on here because he would be your go-to guy to answer any questions. He's fantastic just to be able to help people through the process. His information is also all over our website. So if you don't get it down now, we can always share it later. Our Stages training series, so this was actually developed back at Recovery Resources, and then we took it over a couple of years ago, and it's changed quite a bit since then. We have our Stages training series. Stage 1 and Stage 2 are 12 hours. Stage 3 is 6 hours. And all of these trainings altogether equal 30, and that provides really the basic minimum competency. And as you can see, our first one is really kind of the basics of gambling. The second one is really focused on treatment of gambling disorder. And our third one focuses on a couple of special topics, specifically finances and how to support family members. We do have a couple of trainings that are coming up. This will also be offered quarterly. We just don't have all of our trainings up for the year yet. They'll probably be up in the next month or so, but you can see that if somebody is going through that, it's fairly minimal as a cost, so $140 to be able to get somebody trained. And again, you can use gambling dollars to pay for that. If you're looking for some additional prevention support, we are offering a free training called Integrating Problem Gambling into ATOD Prevention. It's going to be on Wednesday, August 9th from 12 to 1:30. That literally just got up on our website yesterday. We have not even shared it as of yet, but I'm going to throw that link here in the chat. I see some questions popping up. I'll take a look at those in a second. I apologize. That is going to offer some CEUs and basically give just a good, really brief overview of some easy ways that people can start integrating it into some of the prevention work that they're already doing. We also have a much larger, more robust training. SPFing your way through problem gambling prevention. SPF is Strategic Prevention Framework, and we really dig into the Strategic Prevention Framework and how you can do prevention into their communities. We do have some dates that are set up for December and June. We don't have that up on our website yet, but we will be sharing that and sending it out once we have it. One kind of near the end final slide here, where to look for additional gambling funding. So if you're like, hey, we're spending all our money and we could really do more, check out these fantastic places. So Prevention Action Alliance continuously offers some gambling additional funding for prevention folk. Here at PGNO, we do offer a couple of funding opportunities. One of them is through our agency consultation program. So if your agency within your community is like, hey, we want to do gambling stuff, but we need some help, you can actually get thousands of dollars from us to be able to integrate it into your community and kind of get your hand held and walked through by our associate director to be able to do some of that within your community. We also have a program for individual clinicians who really want to dig deep. They get a stipend for participating. They go through supervision with some a clinician and be able to present some information at the end of the year on what they've learned throughout the process. The Ohio Center of Excellence has been something that has offered some grant money, especially this past year. I know some local communities, actually, I know Lake County Adams Board, for example, they recently got some grant funds and they were using it to support the Change the Game Ohio campaign. So always keep an eye open for them. And then the National Council on Problem Gambling, they do offer some programs. One of them is called the Agility Grant. And I know that some of our friends at the UMADOP up in Cleveland just got several $1,000s from them to be able to do some youth gambling focused stuff within their communities. So check them out to be able to look for additional funding and training opportunities. And after this training, what I will be sending out is an email including the Gambling Fund Spending Guide, which was also included in your email today. It really was a lot of the in-depth stuff and just ideas, suggestions of ways to spend it within your communities. I'll also send a link to the new allocation reporting form. And I know Scott didn't mention this. So for this reporting period, you can use the old form if you'd like, or you can use the new form if you want to try it out and have that information. You don't have to. So this will go into effect starting in fiscal year 24. So in January, that will be the new form going forward. I will also be sending out my Calendly, which is basically just an opportunity for you to say, hey, listen, I have lots more questions. Can I talk through some stuff? I'm confused. I need help. Here are my ideas. Are these good? Whatever you need, me and Scott will be able to kind of meet with you and talk with you about that. So if you're like, I really just need some time to talk more through it, you can set that up on your own based on our availability. And then I will also send you some information about some upcoming trainings through PGNO. So it is 10:59. Look at that, half hour on the dot. So I know that some of you may have some prior commitments. So if you need to step away and leave, that's okay. Thank you for being here for a half hour. I just want to make sure I go back and answer any questions. And Scott, if you see anything or want to give any thoughts, let's see.
Just quickly, Claire and I have met with individual agencies. If you want, and we've done things like we've done it at 10 in the morning and 1 in the afternoon. So half of your people can do it in the morning and the other half in the afternoon, or 2 different days, or however you want to do it. But we'll meet with an individual agency and we'll go through these questions with clinicians or further information. PGNO has on their website all of these dates and times for all these trainings that are available pretty much all the time. There's always something going on. And we are all extremely accessible, available, and willing to help. So if there's any way we can help move your area forward, or you have a specific question or problem, or you need, we have really skilled folks that have been, Steve, I see Steve Capel on here, Bruce Jones on here, Nabil up at Recovery Resource on here. We have people that are in this, deep in the trenches and very skilled, that we could actually link you with somebody that's doing the work well, that can help guide you in your process. So anything we can do to help, please don't hesitate.
Absolutely. I will be sending out a copy of the slides as well, and I'll also send out a copy of the recording afterwards. So if you need to review either of those, you're more than welcome to. Diana, I think I just answered your question. Yeah, so starting in January, that's when you'll be asked to use this new form. You can still use the old form for the one that's coming up due in July. Regina, yes. So if you look up somebody's license, you'll be able to see if they have a gambling endorsement. You will not be able to recognize or look at anything competency wide when it comes to somebody who's licensed through the Counselor Social Worker Board. So that's really part of just, being ethical. Like I need to make sure that I ethically have those 30 hours. If there's an issue, I can be able to prove that I have some sort of training specific to gambling, but gambling endorsement, you can definitely look up in the e-license. Kristen, yeah. So when it comes to prevention funding in GFMS, Scott, can you talk a little bit briefly about the GFMS and prevention and how that's typically set up and utilized?
Yeah, in GFMS, there's at the very top, there's standard reporting. You can click on those and you can put in, there's places for narrative and places for expenditure, and you can drop in any prevention stuff that you're doing, and you can access that pretty easily. In our agency here, Shemaine Marsh, which I think a lot of you probably are familiar with. Shemaine is basically our GFMS wizard when it comes to prevention and GFMS. But you can send me any questions or comments. If I don't have the answer readily, I can go around the corner and bang on her office door and get her involved. I saw Joe's thing that we went too quickly through this information. Please reach out if there's something specific that you'd like to know more about, or how we can help with more information. But the GFMS is unfortunately, there's not a place in there for treatment, capturing any kind of treatment data. So we need this form for gambling specific stuff.
And Kelsey, I did see Nabil had posted a little bit later about the National Council on Problem Gambling's conference. So that's the one that's being held in DC this year. That one's coming up here in July. And I know a number of people that are on this training will be attending. So you're still more than welcome to utilize funds before the end of the year if you want to send staff members. Regina, I'll make sure that I include some other funding opportunity links in my email when I send it out. Oh, Scott, I'll leave this question to you. Lauren says, since allocations are based on a percentage, will they go up as gambling revenue in the state goes up?
Probably, I'll say probably. The way that we did it on a population kind of a thing. But as the number fluctuates, and sports betting is added, there will be additional funding through the sports betting has been allocated for 2% to problem gambling addiction too. So that 2% of sports betting will be an increase, and we'll see how that's going to be distributed. We don't have a hard data on that yet, but as soon as we know how that's distributed, there should be actually a lot more money available for everyone.
And then the other question that I see is from Brad. He said, is there any reporting available to help to the boards about how many calls to the helpline come from our board area?
Yeah.
So that is something that we can provide for you. All you have to do is reach out and ask, and we're able to share that. And you can even ask over like a period of time, since January 1, how many calls have been made to our board area. Additionally, there's board specific data related to the voluntary exclusion program, which has recently expanded to include sports betting. So there's a new process for that through Time Out Ohio, which can be actually completed online. People no longer have to go physically meet with somebody. So there's definitely all kinds of data for your local board area. All you have to do is say, hey, can you share that with us? And we can definitely get that for you. Woo, yeah. So we did deliver that super fast, and it was intended to just be as informational and brief as possible. But if you do have additional questions or need anything else, make sure you feel free to either email or sign up for a brief meeting with me and Scott to be able to talk more about it. I will just throw up my and Scott's information up here once more, just in case you need it. And you'll probably be getting an email from me sometime later this afternoon. So I appreciate everybody hopping on. Good seeing a lot of familiar faces, and we appreciate you. Have a good one.
See you, everybody. Thank you.